As the Delta State Governor, Right Honorable Sheriff Oborevwori, marks 1 year in office, his more agenda has come into focus. This special report takes a look at the remarkable feats of the governor in providing more access to affordable and quality health care for Deltans through the Delta State Contributory Health Commission.
Across the globe, health insurance has been known to act as a financial buffer against unplanned, unpredictable, and out-of-pocket medical costs that could otherwise deplete one's emergency fund and savings. Hence, the establishment of the Delta State Contributory Health Scheme to ensure access to affordable and quality healthcare services for all residents of Delta State, irrespective of their socio-economic status and geographical location. The Delta State Governor, Right Honorable Sheriff Oborevwori, in line with his more agenda to bring more dividends of democracy to Deltans, especially in the health sector, swung into action upon assumption of office on May 29, 2023, and appointed 2 experienced result-oriented achievers, Dr. Austin Obidi as chairman of the Delta State Contributory Health Commission, and Dr. Akpoveta as Director General and Chief Executive Officer, with a mandate to effectively implement, regulate, and supervise the Commission so that affordable and quality healthcare would be a reality. Understanding the assignment and poised for excellent delivery, the duo, after their screening and subsequent swearing-in on the 25th of September 2023, hit the ground running by constituting the governing board of the Commission, comprising experienced professionals from key entities, including the Ministries of Health and Economic Planning, the Office of the State Head of Service, the Nigerian Labour Congress NLC, Trade Union Congress TUC, the Civil Society Organization CSO, Nigeria Employers Consultative Association NECA, and the National Health Insurance Health Commission.
We were part of the creation of the commission. It would be interesting to know the exact mandate as we roll into the 1 year in office of the state government, Right Honorable Sheriff Oborevwori. The exact mandate he gave to the commission this time.
Yeah, you are right. I was the member of the technical working group that put together the bill that became law of this commission. Actually, one of the heads of that technical working group. The mandate was clear: implement and regulate a health insurance, social health insurance in Delta State, and in a more clearer term, ensure that all residents of Delta State are registered into the social health insurance scheme to receive quality care without anyone being left behind. If you are in the rural area, hard to reach area, you have no money, everybody must be taken along. So it's a very clear mandate. Enroll all the residents of Delta State into the health insurance scheme. In other words, achieve universal health coverage in Delta State as within the next few years. Actually, the WHO mandated all countries to achieve universal health coverage by the year 2030. And I think Delta is determined to even achieve that before that date.
Today, among other remarkable achievements, the Commission has enrolled over 2 million residents of the state in the Contributory Health Scheme, with emphasis on the indigent and vulnerable members of the society. This has placed Delta State as a front-runner and reference point amongst all states in Nigeria, thanks to the proactive and ever-supportive Governor, Right Honorable Sheriff Oborevwori. As a former lawmaker, the governor understood the provisions of the Delta State Contributory Health Scheme Law of 2019, which recognizes the vulnerable as pregnant women, children under 5, the elderly over 65 years of age, the physically and mentally challenged, the less privileged, and others. Hence, he consistently provided funds to service their medical expenses in the health facilities of their choice through the Equity Plan of the Health Commission. Dr. Akpoveta speaks more on the equity and other health plans of the Commission.
Let me just quickly run through the plans and initiatives of this commission. The law created 4 plans: the Equity Health Plan, the Informal Health Plan, the Formal Health Plan, and the Private Health Plan. These plans, the equity is actually meant for the vulnerable people, those who cannot really afford to pay the small premium of 7,000 naira, and those who are endangered. For example, pregnant women. All pregnant women in Delta State, from the day you are pregnant till you deliver, either by spontaneous vaginal delivery or by cesarean section, is free. And the government pays for it. Of course, there's no free food in Freetown. So it's free to the enrollee, but the government pays. And that's a huge bill. And the purpose of that to ensure that our indices in maternal mortality is greatly reduced, and no woman pregnant in Delta should die in pregnancy, should have any morbidity in pregnancy. That is why. We also take care of every child from 0 to 5 years, with the critical period where children are prone to deadly illnesses, and of course the old and the challenged, physically and mentally challenged, the Equity Health Plan. For that, we have registered well over 1.7 million Deltans. And then the formal sector has to do with the employees of the public and private organized sector. And that all Deltans who are civil servants, public servants, are already enrolled automatically into the scheme from day one. And then the organized private sector, a lot of companies, if I say rule in Delta now, before you contract with Delta State, you must register your staff with the commission and have a certificate of clearance before you can do any business with Delta State. And so the organized private sector is coming in. The informal sector have to do with the artisans and every other person that is not in this group I've described. And we are doing a lot to ensure that one comes in. But apart from the basic plans as entrenched in the law also gave us the mandate that we can create other initiatives to ensure that we cover everybody, all Deltans. And so we have initiated about 3-4 other initiatives. One, the indigent early adoption initiative, the artisan early adoption initiative, inducement initiative, and then we have the T-SHIP. The T-SHIP is Teacher Institution Social Health Insurance, Student Social Health Insurance program. That had been, it's actually a program initiated by National Health Insurance Authority many years back, but it's hardly work in most states. Even the federal government couldn't drive it in universities, federal universities. But in Delta, we did a rethink and redesign of that program. And with that, we're able to convince the universities, and they are enrolling MATs into the scheme at the moment. You saw the flag off we did at the university, where about 4,000 students were enrolled, and then University of Delta, Unidare at Agbon, where more than 8,000 have been enrolled. And other universities are coming and polytechnics. And the reason they are now interested is the redesign. One, the student will receive care from their clinic in the university, which we will ensure that is very standard. Of course, we're going to pay capitation to them. And that capitation, part of it we use in upgrading the health facility in the university to a level that the student will be happy to attend there. Because sometimes the environment of a hospital discourages people from attending. So that is number one, redesign. Second part of it is that the student on holidays can receive care anywhere in the state. With the ID card, they walk to any hospital, government or private, registered in the scheme, we will pick up the bill for them. So on holidays, in campus, outside campus, in the state, they will get care. We also went further. We've discussed with our colleagues in other states to ensure that those students who are in Delta pay their insurance premium in Delta, but they live in Lagos during holidays. They will also be able to attend a hospital registered in Lagos State Health Insurance scheme, and then the bill is sent to us to pay. So we made it very robust for the student that anywhere the student is in Nigeria, it will be taken care of. And this really encouraged the student unions, the university authorities, and it was an automatic success.
Recognizing that most residents of Delta State are either self-employed or not employed by the government and thus fall under the informal health plan, and driven by a commitment to achieve Sustainable Development Goal 3, universal health coverage for all, various initiatives have been introduced to ensure no Deltan is left behind. One of such initiatives is the Indigent Enrollee Adoption Initiative, which provides opportunity for philanthropists, companies, and organizations to adopt and pay the premiums for a year for the indigents in their localities with just 7,000 naira per person. Since its launch, the initiative has seen over 1,000 indigent Deltans registered, as well-meaning Deltans have embraced the initiative. In Okpe local government area, Mr. Midian Obayamo adopted and purchased health insurance for 100 indigents of Jedo community, thereby improving the health indices there. Oshimle North local government followed suit, with a member representing the area in the State House of Assembly, Honorable Frank Esenwa, purchasing for 200 persons. In Anyocha North local government, the Organishu Mwobekenu Foundation adopted and paid for 100 persons in their community. The Urobo Nation also saw their illustrious sons, Honorable John Nani, the chairman of the Delta State Oil Producing Areas Development Commission, the SOPADEC, adopting and purchasing health insurance for 240 women, and Honorable Solomon Irapata, the chairman of the Delta State Board of Internal Revenue, sponsoring 250 women. All the beneficiaries were drawn from the various clans that made up Urobo Nation.
I've been told that other ethnic nationality in Delta State getting the cards, the health insurance scheme, and I know full well that we have vulnerable persons who cannot get this card. So I decided to give for the first phase 10 per each kingdom of the 24 kingdoms in Urobo land, and the 24 kingdom 10 will give you 240. That's what I just did. As time goes on and God helping me, I will do more, and I'm also asking those women in Urobo, women and men, to also contribute to the indigent old women who cannot go to the hospital because of finance.
It's a thing of joy because, like I did say during my speech, that a healthy nation is a wealthy nation. And in line with His Excellency's dream for Delta State, in his more agenda, he promised Deltans that he's going to do more for them. Meaningful development opportunities for all, enhanced peace and security, and of course, meaningful development. So, in line with that, you can see that there are opportunities for virtually everybody. And what I'm seeing today, it's my own way of complementing what His Excellency is doing, because government cannot do it all. So I need to also show love to my people. And this is just the beginning. By the special grace of God, I'm still going to do more in line with His Excellency's more requests for Deltas.
Moved with compassion are the unique challenges faced by persons with disabilities, and a reaffirmation of his commitment to advocating the rights and dignity of people living with disabilities. Dr. Akpoveta adopted and paid health insurance premium for 250 persons living with disability, with beneficiaries comprising 10 persons from each of the 25 local government areas of the state.
Who have graced us with your presence today. See, when a man with disability traveled all the way from Mugeli, from Agbo, from Bomadi, it must be a man with a lot of courage. And so I appreciate your coming to see us here today.
Thank you, sir.
Thank you. The meeting today marks a significant moment where we acknowledge the unique challenges faced by persons with disabilities and reaffirm our commitment to ensuring their inclusion, support, and equal opportunities within our society. We must ensure that you are included in the activities. And I'm happy, yes, and I'm happy His Excellency, the former governor and the present governor, like you've just rightly said, is already doing that. I'm not surprised, because they are men of goodwill.
Catching the vision and in support of their DG, directors in the Delta State Contributory Health Commission have keyed into the initiative, with some adopting 10 persons with disabilities and others 5. Apart from the Indigent Enrollee Adoption Initiative, there is also the Artisan Enrollee Inducement Initiative, designed for craftsmen and skilled workers. They also initiated the Tertiary Institution Social Health Insurance Program T-SHIP, aimed at ensuring quality and affordable access to healthcare to students in tertiary institutions in the state. With approximately 8,000 students from the Denis Osadebe University DOU and the University of Delta Abo already registered, and more underway, a significant milestone in healthcare accessibility for students in Delta State has been achieved.
Yes. Because you need to repackage your processes for people to, your product. You know that people repackage products in terms of other things they sell. In insurance, you produce a product and then you sell it. And I'm sure that is why that scheme is coming in. Delta has a lot of universities, a lot of institutions, and all of them are coming. Actually, by the next session, virtually all of the universities will come in. Because they have some arrangement prior to this new initiative, they've asked us to just give them a time to reorganize themselves, and they will come into the scheme.
To ensure the enrollees start assessing care immediately after they are registered, the Director General moves with his officials and registration equipment to enroll residents into the scheme and presents them with their health insurance cards on the spot. In all of this, the hard-to-reach areas in Delta State, especially those in the riverine communities, were put into consideration. Hence, the Access to Finance program, a public-private medical partnership which has been running since the inception of the Commission, was sustained. The arrangement, which allows private sector organizations to upgrade, manage and run health facilities in hard-to-reach and underserved communities, has helped provide more access points to healthcare and spread good health in those areas.
Starting from first, it is a good thing that we have health insurance, because it's been able to cater for a lot of people, those that cannot actually afford healthcare out-of-pocket payment. In spite of the challenges which comes with health insurance, so far it's been good in delivering services to the targeted people. It's meeting their challenge, particularly the children, the pregnant women, and in fact entirely the family. For the patients, it's been doing well, though we know there is need for improvement, particularly on the area of the coverage. We look forward for it, for more people to come on board. But that is so far for the patient, it's been wonderful, and they have testimony. And because globally health insurance don't cover everything, so even in the Western world, it's not everything they cover. So for the ones that is covered by this scheme, so far the patients have good testimonies and they are happy.
The success story of the Delta State Contributory Health Commission has attracted different categories of persons and groups to the Commission, including the Odiolobo of Oyede Kingdom, His Royal Majesty, Dr. Idiare J.I. and some palace chiefs. The Association of Resident Doctors, Federal Medical Center, Asaba, the Nigerian Medical Association, NMA, Delta State Chapter, as well as proprietors of community newspapers. They all showered encomium. Even when the Delta State House of Assembly Committee on Health visited the Commission as part of its oversight functions, the leader of the delegation and chairman of the committee, Honorable Ferguson Onwo, said the committee was satisfied with the robust operational framework and structure of the departments in the Commission and promised to address whatever challenge the Commission may be grappling with.
Basically, I want to begin by saying you're welcome. You're welcome, and I hope that this coming will be the beginning of very great partnership between the legislature and this small part of the executive. Thank you and God bless you.
If you want to register 1,000, for example, it's about 7 million, the bank will give you the loan. You pay over time to the bank, and meanwhile, you are receiving care in their home.
So when I said I'm excited here, because what I've seen here, you are doing a great job here. And I've learned something here. I don't know whether my members already noticed it. I don't know whether the reason why you're associated is that you are gender friendly, because I see most of the stuff about You see what I did here to show that I'm really interested. I ensured that my vice enrolled immediately. I also ensured that my lost ID card I was able to retrieve it. I did that to show you that we in the committee, we have decided that I'm going to stand by you. I told my committee members and some other members that this program is the cheapest I've seen. But there's no doctor that are going to consult even without treatment that are going to pay 7,000. It's not possible. So if you are even getting that for that consultation before, because most of the drugs are not available, yes, but they have been able to know the reason why you are sick. You are sick for some reason. This is your problem. So with that, we are convinced that the program should be on course. And in doing that, I encourage my members that when we leave here, we sit and look at the challenges which we discussed openly and the one we have discussed behind. I was still going to discuss behind. Because this is a program that must not fail. If it is true that you are leading in the country in this program, others are following, we must ensure that you remain at the top. So that we can partner with us. We pride ourselves as the most vibrant house of assembly in this country, for which nobody has questioned us. So if we're in the House Committee, I also lead this, we have made something together. Our spirits have met at a particular point. And I also members that we stand by you at all times. So ensure that your challenges. We're very happy with what we saw here. The program is on course, and this program needs to be sustained. And we are vowed that we will do all that is possible to ensure that this program is on auto-course. We can run without hitches. If it's by way of legislation or by way of interface, any intervention that we need to do to ensure that this program goes on, we will do it.
Little wonder, the Federal University of Petroleum Resources, EFRUN Center for Sustainable Development, decorated the Chairman Governing Board, Dr. Austin Obidi, and the Director General and Chief Executive Officer, Dr. Isaac Akpoveta, as SDG Champion and Fellow respectively, and gave them awards in recognition of their commendable contributions towards the actualization of SDG 3, which is to ensure healthy lives and promote well-being for all at all ages. They have this to say.
Contributory health scheme is the major funder of health in the state, and a lot of deleterious effects of climate change and, do we say, environmental degradation, they impact on the health of the people. Prevention, they say, is better than health. Prevention, they say, is better than cure. Then beyond that, if you are healthy, there is something we as doctors call promotional health. You know, you are well, you want to stay well. So, Contributory Health Commission partnering in a way is part of pushing and propelling the more agenda of Right Honorable Sheriff Oborevwori Francis, our amiable governor. Thank you.
On SDG sustainable development of the society, Delta is very much aware, apart from other activities through environmental protection and so on health. The SDG 3 is very paramount. It's about you and me and how to curtail the effect of environmental damage on us, and Delta State is forefront. We are doing that. We have got so many initiatives to ensure that we have the indigent enrollee adoption initiative, where we appeal to people like you have some more money to buy insurance for your neighbor who cannot afford it himself or herself, and just 7,000 naira per year. And I can assure you a lot of people are buying insurance for their people, and I'm happy about that.
Dr. Akpoveta and Dr. Obidi, despite these achievements, said more will continue to unfold under Governor Oborevwori's leadership, as the Commission is determined to break all barriers and create a more inclusive healthcare system that caters to the diverse needs of the population.
The artisan comes in, rather than go to the chemist or visit the Agbo woman or engage in self-help. He goes to any of our 60-something government hospitals, close to 200 PACs, and accredited private hospitals across the state is available. Then the last but not the least, we have this tertiary institution social health insurance program. I'm sure the airwaves have been carrying it. Went to Denis Osadebe University, we're enrolling the students, because a healthy mind is the mind that can do well in school. We've been to UniDel, University of Delta at Abo. Discussions are on with all the other tertiary institutions like Delsu Abraka, the School of Health Technology, colleges of nursing sciences, and the likes. So that is in the area of coverage. But the question to ask, you get all this humongous figure, how do you take care of them? His Excellency has been wonderful. There is regular phase rehabilitation and maintenance of hospitals. His Excellency the Governor has given us his full support all the way. Like we say in our local parable, the person when Papa send message, now with gumption, the kick door open. He's behind us all the way, including Her Excellency, who I'm sure you know also has this program, You Matter. There is a health part of it. But coming back to the second thing I was mentioning, that if you have this humongous population of enrollees, what do we do? It's very important. It's not an accident that after being chairman of HMB for so many years and being a medical doctor for so many years post-graduation that providence and maybe some planning up there brought me here to be the chairman. And we have a DG who is very well versed in insurance matters. So with us and the other 8 members, we insisted that our hospitals, as the Excellency is rehabilitating, re-kitting and re-equipping them, the human touch must come in.
The state government has graciously been very supportive of the Delta State Contributory Health Commission, which has been in existence for some years now, and thank God that the present governor has continued with the legacy of the previous government. And I want to say that so far it's been a good experience because we've been able to meet the health need, most of the health needs of most of the people in Delta State, a large number of people in Delta State, because we know that healthcare is not cheap, especially with the current economic downturn. A lot of people cannot really afford healthcare. So for instance, you see a pregnant woman who cannot even eat 3 square meals. You tell her to come and pay 300,000 for CS. She really cannot afford that, but with the help of the state government, Asaba Specialist Hospital has been able to offer free maternal care to her patients. In fact, our delivery rate is about 180 per month, and we do about 60 to 7 cesarean sections every month, free of charge. And a lot of indigent people have actually benefited from this, and it has gone a long way to reduce the death among pregnant women and their children too. So I would say that the state government has indeed done very well, because with the scheme and the support, the drugs and all of the things that go with it, as a hospital we've been able to offer care to our patients as at when they need it, and without them having to worry about the financial aspect of the care that they require. So I want to thank the state government and say we hope that this continues, and the Deltans will definitely be very happy with it if it's something that goes on beyond, as in beyond now. Yeah, healthcare is not cheap. So we attend to, in this hospital, we attend to over 10,000 patients most months, and that's quite a lot of patients. Yeah, for the pregnant women who all accessory care, we see over 3,000 of them every month, both outpatients and inpatients, minus the children less than 5 years who are also under the scheme. So it has the contribution. So that means that our bill to the commission is actually very high. Yeah. So what they do is they pay us from time to time, and usually it comes in bulk. So, you know, normally patients come every day, they pay small, you know, your money is building. But when contributory health pays us, the advantage is that we can actually use it to do something capital for the hospital. So you see things like the endoscopy machine that we've bought. It also helped us to buy our X-ray machine. It helped us to do some expansion in the hospital. Indeed, it has do accreditations, which cost a lot of money. So because you cannot really get that money in bulk from a day-to-day business that you are running, because patients don't pay in bulk like that. So, but with the Contributory Health Commission, it has really helped us to do a lot in terms of developing the hospital. So it's like a win-win situation. So we have some patients who pay every day, and then the commission that pays maybe once in a few months, you know, and that has really been useful to us in terms of developing the hospital. I know that the premium for contributory health in a year in the informal sector is 7,000 naira. A little money. So I know if somebody has malaria and has chest infection, you are certainly going to spend more than 7,000 naira. So just imagine your family and all of that, the amount of money you will spend if you are paying out of pocket compared to if you just pay 7,000 naira for you. So I think it's something that people really need to be advised. They really need to key in and assess the care that is being offered by the hospitals and by the state government, because healthcare, like I said, is not cheap. So I want to use this medium to advise those who have not keyed in to please do so, because with a little amount of money you are able to access a very broad range of services that otherwise you would have spent a lot of money on. So I know that there are a lot of Deltans who are not civil servants, because for civil servants you are enrolled in the scheme as a civil servant, so you are keyed in. But for people in informal sector, in private sector, you know, they are not really part of the scheme. Most of them are not part of the scheme, except those who pay that premium, or if they are less than child less than 5 years or a pregnant woman. So for those other sector of people, I really want to encourage them to key in, because it's really good. It helps you to save money, and then nobody budgets for sickness. So when a sudden illness befalls an individual, you know, you have a health insurance backup to fall back on. So I think that everyone should be encouraged to get themselves registered and access the care that they require. Yeah.
I love the way they paid attention to us and they served us, and the CS, the way they told us that it's free. I have confirmed it that it's free, that nothing is to be paid. And from the other places I've been, like my first daughter I had by CS, I paid 300,000 at the end of the day after buying so many drugs that I bought in order for them to carry out the services. But here, I've seen something different, and I want to thank the government for this wonderful scheme they've provided for.
I think it makes me feel happy. There's always little things that I will just, little things I do not have, I will just go outside and buy it. Not much. Not like I will start from afresh, pay for bed, pay for everything. I'm not paying for anything, just the one they don't have. They will not tell me to go outside.
Telling my friends, the people don't know, let them come and register for health insurance for this, our hospital here.
I was referred here by my friend who gave birth. She said everything is right. At first I did not believe. I said, how possible it is? So I said, let me just come and try with antenatal. So the first antenatal I came, it was free, registration, everything. Seeing doctors and drugs was free. So I continued till my delivery with CX. And after everything, I did not pay any money. So I'm so happy for the free offer. I'm happy for the governor, what he had done for us. I really appreciate his effort. It's not easy.
According to Warren Bennis, an eminent scholar and author, leadership is the capacity to translate a vision into reality. As Right Honorable Sheriff Oborevori marks 1 year in office as Governor of Delta State, it is evident for all to see how he has proven himself a true leader by bringing into reality his vision of providing more health care for Deltans.
As to pull the drones back home, it is one thing to see most of these activities going to full gear. How much of political will, how much of encouragement would you say you received from the government to get most of these things stretched out?
Without the political will, health insurance cannot work in social insurance. State-run social insurance cannot work. And so that we have gotten this so far means that there have been a strong political will. Political will is not something you can grab and see, but you see the effect. That regularly we get people enrolled in, we got funds to pay for services rendered, we have funds to run the system here, mean that fund is being released to us. And it's only a political willed system that releases funds to an agency. And so that is there. And I wasn't surprised, and I'm not surprised, because the present governor, Right Honorable Sheriff Oborevori, was the speaker, was a member of House of Assembly when this law was passed. And he has been defending and supporting the system even before he became a governor. When he was a speaker, he did a lot to support us. So I wasn't surprised that when he took over, the goodwill of the former governor, Senator Ifeanyi Okowa, continued. And I will tell you one of the signs of goodwill, political goodwill and force. Reappointing my honorable self from the chairman to go and come and sustain the system It's a sign that you want the system to survive. Instead of bringing a brand new person, say no, Dr. Akpoveta, come and stabilize the place, come and sustain the place. And so that is very important. It's a sign that he's determined to ensure that this place works. And since I came in, I've been very supportive, financially, politically, advice-wise. And so I must thank His Excellency the Governor for his effort to ensure that Deltans, the more agenda is very clear. He wants to do more. Symbolically represented, want to do more for Deltans. And what is more than good health for people? So Sheriff cares. He cares for Deltans. He wants to ensure that Deltans get good health and quality health care in the system. So there is a lot of political goodwill from the government.
And 85 and 30 men of praise were initiated by this administration. Few days from now, we shall commence the commissioning of some of these roads and other projects in other sectors for the world to see what we have accomplished in 1 year by the grace of God. I will conclude my remarks by saying that the past 1 year has been one of trials and triumphs, tests and testimonies, and adversity and good. Through it all, God has been faithful.
Indeed, putting square pegs in square holes makes the job easy. The more agenda is working and the residents of Delta State are happy. Expect more quality and affordable health care under the leadership of Governor Sheriff Oborevwori. Congratulations, our dear Governor.